Joining me now is New York City Council Speaker Corey Johnson. Mr. Johnson, great to talk to you again. Thank you very much for taking the time to join us. Let me begin by asking you about Mayor Bill de Blasio. He's saying the city could be out of ventilators as early as tomorrow. What is the plan for when the city runs out of those ventilators?
Well, I was on a call last night, Eamon, with the mayor and with the members of the city council being briefed on where we are as it relates to ventilators and personal protective equipment. And the reports that you just heard from the great correspondents in the field really fit with what we're seeing here in New York City, which is we are trying to get ventilators and the personal protective equipment from other places outside of Washington because we're not seeing enough. We saw 600,000 N95 masks were announced to be shipped to New York City in the next day or so. That is a fraction of what we need. It looks like we need about 1,000 to 1,500 ventilators to get us through the next week. And you saw the governor of Oregon sent us some ventilators. The governor's been working on getting them from China. We have really been at the local level trying to piece this together, which has shown how dismal the coordinated federal response has been, not just for New York City, which we know is the epicenter in the country right now, but you saw the report in Suffolk County. You've seen what's come out of Detroit, New Orleans, Chicago, other places across the country. We need a coordinated federal response where you don't have states and the federal government and localities all competing against each other. There was a report yesterday of a local official in Chicago who was racing on a highway to meet up with someone, I believe, at a gas station to deliver a check just to get some personal protective equipment. This is no way to actually get folks the supplies that we need.
Let me get your thoughts on the intensive care unit and our capacity in this city right now. Can you just give us a quick check on where we stand in terms of our capacity?
Well, it's a moving target, and we've had to actually build, of course, not just more hospital beds themselves, but more ICU beds. And what you're seeing right now, not just in the public hospitals, which the city of New York runs through city government, but also through the voluntary private hospitals, you're seeing hospitals be converted just to COVID hospitals. You heard from one of the reporters a few moments ago that elective procedures were canceled a while ago. What we really need here is to actually have the Javits Center and the Comfort take COVID patients. You saw the president talk about how that's going to happen. While you have the strain on our hospitals, you have these two large facilities that are not anywhere near capacity. ICU beds are really about staffing and about the ventilators and equipment. That's what makes something an ICU bed. And so simultaneously getting the equipment, getting the ventilators, getting the staff. We saw some military nurses and doctors come to New York City. We've seen thousands of people sign up in New York City who are retired health professionals, and a lot of people from across the country have signed up to come here and help us. That is what's going to allow us to create more beds. We are doing okay on that point, but it's a day-to-day thing, and we're looking at the number of hospitalizations and where that number is. You see the governor updating us every single day. That is what tracks what on a day-to-day basis.
Mr. Johnson, finally, I just want to get your thoughts really quickly. This pandemic has obviously exposed a lot of disparities in our society. There is a growing push for data on potential racial disparities in terms of what the impact of coronavirus has been on our city. Does that data exist now for New York City? Have you been able to see it? Do you see any racial disparities with how this virus, this pandemic, is impacting our community?
There are, without doubt, racial disparities. You've seen the hardest hit neighborhoods be the neighborhoods that are predominantly low-income communities of color. You saw just a little more than a week ago what was happening in Elmhurst. That is a low-income community of color. A lot of undocumented individuals live in that neighborhood. The Bronx in New York City is now being really hit hard, and the Bronx has the highest number of low-income people of color in New York City. as it relates to the boroughs. We do need this data. On the call last night with the mayor, the council members were pushing for this. He was saying we will get that information in the coming days. We need it. I know we have to go, Eamon. I just want to say a lot of people are struggling. There is a collective trauma that's happening right now. We want to protect our essential workers. They need that equipment. We will get through this if we remain unified, but we need help from the federal government. New York City is the canary in the coal mine right now, but we are united. We are one New York, and we are looking out for one another. And I appreciate you highlighting what's happening here every single day. The country needs to see it because it could be what's coming to them.
All right, Speaker Corey Johnson of the New York City Council. Speaker Johnson, thank you very much for your time.